how we could make healthcare better.
Approaches that allow every worker to improve their work.
Not as consultants, more than even facilitators, but partners.
Healthcare Performance Partners and its affiliates have worked for more than a decade to partner with organizations throughout the world, helping them learn and apply Lean, Six Sigma, quality tools and systems, and the latest in facility design concepts to their industry. With each client engagement, HPP brings years of experience from various industries, including its vast background in working with healthcare organizations of all sizes.
The goal of HPP is, and it's always been, to partner with our healthcare clients in the improvement of their performance. Performance meaning improving quality or safety or their financial position or satisfaction for all involved in the value stream. And we strive to do this in a proven but a very practical and flexible manner.
It means that we're going to look at work with the ability to recognize where the muscle is and get rid of some of the fat, if you're going to use the analogy of lean. It does not mean cutting staff. It does not mean cutting the service to the patient. It means making the service better. It's not top-down. It's not just theoretical. It is practical. It really happens with the people who do the work. And again, you can do it anywhere.
Lean is very powerful. We set our goals for not 2 to 3% improvement, but 30 to 50% improvement.
The results of our engagements have been remarkable, but the leadership of our clients must be front and center. It is this strong leadership that makes the results possible. Our goal is to train leadership and to coach them and to guide them through this process towards success.
The concepts that HPP teaches have been proven in industries for decades, and the HPP team has spent years perfecting the application and teaching of these principles in a variety of healthcare settings.
HPP brings a huge amount of experience to the table in protecting and supporting our people in the changes that we're asking them to make.
It engages the people who do the work, and the ideas and the good ideas and the intelligence is mined to bring those good ideas out.
Healthcare Performance Partners are unique in the fact that they do not create dependency upon them as consultants. Their job is to wean you off of them as facilitators and as partners so that we can fundamentally stand on our own as a lean organization.
Much of what we do requires significant buy-in from our client staff members, from the registration desk and the nursing station all the way up to the C-suite. We found that you gain buy-in not by doing everything for them and certainly not by doing it to them. You gain this critical buy-in needed for a transformation by partnering and working with them out on the front lines and by positioning them to be successful.
To make a client's transformation or specific engagement successful, HPP provides a wide variety of services and approaches, from lean healthcare training programs, value stream mapping, 5S projects, and A3 thinking, to leadership coaching and training. HPP offers hands-on simulations, like its trademark Healing Healthcare Pharmacy Simulation and Job Instruction Simulation, plus Lean Six Sigma Healthcare Integration. HPP even provides healthcare consulting services, project management support, and review courses designed by clinicians that teach Lean to frontline staff. They're also at the forefront of the industry in providing conferences, retreats, and certification courses in the USA and Europe. HPP is on the leading edge of applying these concepts to create safe, efficient environments for patients and staff through their lean-focused facilities and clinical design services.
Lean clinical design is working with architectural design firms to improve their design by being an intermediary between the hospital staff and the architects to help them to improve efficiency, reduce waste through lean principles. We really focus on all of the stakeholders, and that is the patient, but also the staff, and making it a supportive environment for them and a good place to work.
The HPP staff is made up not only of Lean and Six Sigma experts and engineers, but also physicians, nurses, and healthcare administrators who understand the unique challenges and expectations of the healthcare industry.
And it was nice to be able to have a group that you could work with that understood your business as well as you did and really had a different lens on it so that your worries really became not worries for you.
HPP starts by understanding each client's specific goals, and these proven concepts are applied to result in impactful, self-sustaining changes throughout an organization.
After 2 years, we were able to show significant financial savings in the 7-figure range.
What is the value you place on a life or a person's health? And we were able, with HPP's guidance and collaboration, to actually keep our patients safe.
Lean is very powerful at asking the caregiver to help design what the new work is. Lean keeps the power with the caregiver.
I've observed Lean in a large number of healthcare settings, and I have to say that HPP really excels at engaging hospital staff in accomplishing extraordinary things. But in everything they do, their focus is on their client's ability to sustain those gains and keep progressing long after the engagement ends.
HPP understands the power of satisfaction for the patient, the patient's families, the caregivers, the physicians.
Our nurses are spending 25% of their time with the patients. After one Lean event within 90 days of implementation, we saw that percentage increase from 25% to 49%.
As a physician, I care about my patient and that they get the best care they can without errors.
HPP understands that quality and safety focused on the patient is the best long-term strategy for improving the process for everybody involved, ultimately lowering cost, but with a constant focus on quality.
What HPP does for us is make it easier for us to learn how to do that.
On the direct caregivers, it's probably about retention of staff, not getting frustrated with work and being able to do what they believe their calling, which is to take care of patients much more efficiently and effectively, so that they're getting rewarded personally and professionally for what it is that they choose to do.
Lean methods improve quality and safety while eliminating waste. HPP can tailor a practical, focused approach that quickly generates enthusiasm among your staff and sustainable improvements in all these areas and more. For improved performance from a proven, practical, and client-focused firm that seeks to partner with your healthcare organization, call HPP. Solutions, results, success. That's HPP.